Want me to start?
All good.
Okay, all good.
Started.
All right. Then let's kick start and let me share my screen. I to start off with the meeting. So you will be able to see my screen, which is on the meeting agenda landing page. So by way of the agenda, we have 7 items to discuss today. The usual administrative stuff, which will be approval of the meetings of the previous meetings, and then moving on to the other sort of action items. So without further delay, so we have 2 meeting minutes in the past to approve. But before we go into that, anyone has any comments or changes that you want to make to today's meeting agenda? Okay, hearing none, I will take silent as an assent that the meeting agenda is agreed upon and will progress on the meeting agenda as such. Now, the first item of order, the meetings of the previous 2 meetings. One is January the 17th, the other one is January the 31st. We have here the January the 20th, January the 17th meeting minutes. I assume that comments that came in were taken into consideration, and the meeting minutes are amended accordingly. So that's the first meeting minutes. And for anyone who wants to peruse the meeting according to their own leisure time, here are the links to the meeting minutes. So that's the first one. And that's the second one coming your way. All right, let's look at the first one. All right. Are there any questions, any further changes that members attending today's meeting would want to raise?
See
All
Danielle's
right.
hand.
Sorry.
I see
Yeah,
Danielle's
I've
hand.
yeah, sorry.
Oh,
I've
okay,
raised my
Danielle.
hand.
Yep.
I have only really started going through the minutes. I think they got exposed this morning.
Okay.
So I'm not comfortable approving at this stage.
All right. Okay. Since that we have concerns about not having sufficient time to approve the meetings of the 2 previous minutes of the 2 previous meetings, then I would suggest that we defer these minutes to the next meeting. Any objections to that? All right, hearing none, then is approval by assent that we will defer these 2 meeting minutes, 17th of January and 31st of January, together with today's meeting, which is the 7th of February, to the next meeting. Okay, all right. All good then. Agenda number 2, actions from previous minutes. The missing previous minutes are now provided as per the link on the agenda and the link that I sent out on the chat. So that action item is being done. And the second bullet point will be FHIR Work Group co-chairs to discuss scheduling for a face-to-face meeting on the 20th of March. I think that is being covered so on in bullet action number 5. So we'll defer that bullet point to action number 5 or agenda number 5 for discussion. All right. Any disagreement on that? All right. If not, then I moving on to action agenda item number 3, updates from Brett. Brett, take it away.
Stephen, I'm chewing. Just to note, last meeting we discussed discussed a project proposal, the synthetic data project. We have done a rename and updates based on feedback. So that is up now for an e-vote. So the link is there with that document. Daniel.
Can we send out an email for that to announce
no, we
that?
haven't. No, we haven't, but
but
I will do that. Yep.
Okay. So
Yep.
you're happy to
Well,
take an action to send that out today?
That'd be good. I'll get that done straight away.
Okay.
So that e-vote's broken into 2 parts. There's actually a project proposal and a project scope statement in that document. So if people could, just do reviews on that and finalise their position on that, that would be great. I have that open for a week and a half, so closing next Friday. And so that's all there now on that link.
So Brett, as per international practice, they usually 2 separate sort of documents, 2 separate conference page or Jira pages if they were to be sort of presented to members, so therefore they can be reviewed and voted on separately. Are we lumping them all together in one, or are we separating them into 2?
There's actually two separate votes. They are on the same page, but there are 2 separate parts. Part 1 is the project proposal, and part 2 the project scope statement. They are combined into a single document, but each section, is for each part. So yeah.
Okay.
Yeah.
Any questions from members? All right. If not, then the action item arising from that is Brett to send out an email to members, notifying them about these action items and progressing with the votings, comments, etc.
Will do. Thanks.
Thank you, Brett.
That's all from me.
Oh, yeah. By the way, just a remissive point from my part that I would like to thank Dushi for gracefully agreeing to take minutes for today. Thank you, Dushi. All right. Action item number 4, further discussions on adopting elements from the HL7 Gender Harmony work. Brett, since you are the lead on this item, I'll let you lead the discussion. Do you want to share, or do you want me to share?
Well, I think Ruben's the lead.
Okay. I'll stop sharing and let Ruben drive the discussion by sharing. Here you go, Ruben.
All right, thank you, Stephen. Just give me a moment to share my slide deck. All right, will someone let me know if my slide is sharing?
Yep.
Your slide.
All right.
Up.
Great. I want to start by thanking the co-chairs for entertaining this agenda topic, and in particular for arranging this out of session so that we could have this discussion, so that if this proposal is accepted, it can make it into AU base within the timeframes we have. So I think all of you on this call know me, so I won't spend time introducing myself. We're here to discuss a tracker item which I've added for AU base called Adoption of Gender Harmony Recorded Sex or Gender Data Element in AU base. And I'll go to the next slide. So I'll start with what the objectives and non-objectives of this discussion is. RSG is a particularly thorny topic, so I thought I might just make it very clear what we're discussing and what we're not. So today I'll be giving a really quick refresher to everyone about what RSG is, just for those who might not be familiar on the call. I want to spend a bit of time explaining the drivers I see for introducing RSG in AU base. And then we'll go through an overview of the various parts of the proposal as stated in JIRA. And there can be questions throughout. Happy to take questions that I might ask one of the chairs to let me know if there's a question, because I can't see hands or the chat while I'm sharing. All right, so the non-objectives, please note, this is about AU base and not AU core. So we won't be discussing introducing RSG and AU core in this discussion. There is another tracker for that, which will hopefully come up in some agenda in future in the AU core TDG. And secondly, AU base typically doesn't have must support elements, and accordingly, this proposal is not in any way suggesting that RSG be adopted as a must support element. I just want to make that clear straight off the bat, because I know this attracts a lot of discussion in these meetings. Are there any questions before I jump in? All right, not hearing anything. I will proceed on the quick RSG refresher.
Sorry,
Yeah.
Ruben, I was talking in mute. I think Brian
Okay.
raised a questions in chat.
Do you mind reading it, Stephen? I'm not sure it's going to
might be
come up
of interest to a recent HL7 international tracker item, and that tracker item is a JIRA item 544514.
It's the one that
Thank
you are already aware of, Ruben. Now it's just when you get
Is that the one regarding codable reference?
Yeah, yeah.
Yeah, thanks for that, Brian. So just spend a quick moment explaining to everyone what that's about. When the RSG FHIR extension was added to the FHIR extensions pack, one of the sub-elements of it, I think it's source document type, was a codable reference data type. And that's a data type that was introduced in R5 and is not natively available in R4. Work is underway to try and make it work with R4, but that's, I don't believe, reached any sort of consensus on how they move forward. The tracker, Brian has noted, was a proposal to change that data type to be a choice element, including the two usually constituent parts of a codable reference data type, and that's a document reference or a codable concept. And so that was voted on at last week's working group meeting, and the proposal or the resolution to that was to replace the codable reference with the two other data types, thereby making it compatible with R4, which obviously serves this proposal. Thanks for flagging that one, Brian. Right, so what is RSG? Just very briefly, because I know many of you have heard this before. Really, it's one of the data elements developed in the multi-year Gender Harmony project and is now published in the Cross-Paradigm Gender Harmony Implementation Guide. Essentially, RSG is used for information which includes various sex and gender concepts. The key aspect of it is that they are absolutely known to not accurately or reliably represent gender identity or sex parameter for clinical use or attributes related to sexuality, etc. The point here is to differentiate all this data, and to be fair, a lot of it is legacy data from the time, which I guess we're kind of still in, whereby there's a single field used to capture sex or gender interchangeably. Accordingly, those values can't reliably be used when referring to a consumer for their gender identity, and is potentially clinically unsafe to use for clinical care. So it was identified that to address the requirement to accurately tag or mark this data as such, they introduced the recorded sex or gender data element. The source for this information is pretty much everywhere you look at the moment, unfortunately. So almost all applications which record gender or sex in a single field, medical records, identity documents like passports and so forth, insurance and other administrative documents, and other relevant sources. So the context for this data element is at the patient level. You typically not expect this sort of thing to be in the context of a procedure or a prescription or something like that. It's usually collected along and stored along with other patient demographics like address and so forth. In FHIR, it can be implemented through adoption of the individual recorded sex or gender extension. Now, I should point out that there are other ways of implementing this, but the individual recorded sex or gender extension is the one recommended by Gender Harmony. I think principally because it allows capturing of additional attributes related to the RSG value, which we'll get to shortly. So in terms of the use, as I said, it's a bit of a tag for non-reliable sex or gender values. Sex assigned at birth, which is a well-known piece of information which is captured, is an example of an RSG value. There are administrative processes like ordering and billing. Medicare sex is a great example. Understanding patient history, legal and regulatory requirements, as well as patient identity determination. So that's the quick refresher. Are there any questions on RSG before I move forward? All right, moving forward. So a few minutes on why I'm proposing that we introduce RSG in AU base. And they really break down to these 4 reasons. First of all, legacy data. Obviously, we have a situation now where health services really need to know whether the sex or gender information they're sharing or which they receive can be relied upon as a consumer's actual gender identity or sex category to inform clinical care delivery. And they also absolutely need to know if it can't be used for those 2 purposes. And that is something which RSG addresses. Secondly, standardization, driven by the aforementioned need. I can absolutely tell you that there are organizations already looking at adopting RSG. Queensland Health is one of them. And standardization, therefore, is a driver here, I think, because if we introduce it in AU base, given AU base's profile in Australia, it will absolutely drive national standardization in the adoption of this data element and will thus minimize adoption in varying and potentially non-interoperable ways. The last thing we want right now is for multiple government agencies and private sector organizations all adopting RSG in non-interoperable ways, because that'll just exacerbate the problem. Thirdly, SPARC, obviously, the SPARC Clinical Design Group for the Australian Core Dataset for Interoperability, or AUCDI, have included sex assigned at birth as a core data element, along with gender identity and pronouns. And thus, there's a driver for adopting RSG in AU Core. And as we know, AU Core will leverage AU Base. So if we can get the foundations and fundamentals resolved in AU base, then it's available for adoption in AU Core. And that's all I'm going to say about AU Core in this meeting. And lastly, supporting more use cases. Because the RSG values, as I said, have attributes which assert the source of the sex or gender value, they have additional utility for context-specific healthcare-related interactions. For example, if you had the sex for Medicare recorded and it differed from gender identity or other information you had available, then you'd know which value to use for a Medicare claim, as an example. Similarly, identify, lookup, and validation for things like the HI service. So those are the drivers I see for introducing RSG in AU base, and I welcome any questions if there are any.
Ruben, I just wanted to make a comment, and you know my point, but I'm just driving it home again. That I think the point 2 is rather watered down because we're talking about AU base and not HL7 version 2. So I think there's still a vast risk that many institutions aren't using FHIR yet, and probably don't see themselves using FHIR in the next 5 years. Maybe it's coming. I'm on the bandwagon, but I think it'll be slow. And I think RSG, the use of gender identity stuff is already getting ground, but in a V2 space, and yet we're very poorly standardizing V2. So I'm worried that we're shooting ourselves in the foot, because people are going to go do this in V2 in whatever strange ways they like, and then when they come to FHIR, it's all going to not be aligned because we didn't do the work in V2.
I'm really glad you mentioned that point, Angus. It's a very important one. Well, I guess the first thing I'll obviously say is I absolutely agree with that point. Secondly, I guess the good news is that the Gender Harmony cross-paradigm implementation guide is indeed very cross-paradigm and has worked with the HL7 International V2 people who maintain the V2 standard. And I believe V2.9.1 has introduced support for RSG. Not that support is immediately adoptable or appropriate in Australia, but they have done that. And this work, whilst it is in this proposal very FHIR specific because it's AU based, I'm fairly certain that the approaches, in particular around terminology, will be transferable to leveraging what V2 has done at the international level for use in Australia. But to your point, obviously, and we've spoken about this, the real challenge there is the change management piece, in particular with legacy systems, which have varying levels of support and changeability, or how well they can adapt to changes in this space. What we really need is an initiative around doing this in V2 and probably CDI as well. Thanks for that point.
And I just highlighted, I'm rather deflated from the work that has been done in V2 at the gender harmony level, because it is all focusing on version 2.9, and it's approaching the problem by introducing new segments which are incompatible with lower versions. So the advice is to go look at their V2 is not of much use here in Australia.
Yep, noted. Thanks, Angus.
Thanks, Ruben.
Are there any other points or questions before I proceed?
So just a point in response to Angus' comment, are there any pathway for us in the V2 world to do early adoption?
I'm going to defer that one to Brett, because I have heard murmurs of a V2 work group emerging in HL7 Australia. Brett, do you want to comment?
Only that there is an intent to have a V2 work group, and we have had people who are making noises that about getting that group reformed. So I think that's on the agenda in terms of getting the group back together, and I think that would be the appropriate place to have this discussion in detail, probably. But obviously we need to be able to convey the meaning and concepts here appropriately to that group, and obviously take it in the context of the current V2 world in Australia. We will probably need to think about that in terms of an actual solution.
It'd be pretty tricky, because going from 2.3 or 2.4, you got to go to add the participation segment to get to 2.7, and they're adding new segments. I haven't really looked at it, at 2.9 to deal with RSG and stuff. It's a stretch. I reckon they just might as well just jump ship and go to FHIR. It'd probably. Yeah. Anyway,
but David, so, we have ADT feeds, we have V2 at a huge scale across the system, and to just say, the answer is to droop to FHIR is really not workable.
It's a big jump to work down those things, to get all those other things in, even in V2. It's going to be. It's not an easy thing.
Yeah, but there's workarounds we can do. Like, I suspect we'll have to use OBXs. We'll use the same terminology, but we'll use OBXs to pass it around. It's not great, but that's just an idea. We need to reform the V2 group, and I would have thought this is a high driving reason why we need the V2 group to reform.
Cool.
I'd like to suggest that we don't need this conversation to be completed to make progress.
Thanks, Richard. All right. In the interest of time, I'm going to continue. I should point out there'll be more time for questions at the end as well. Okay, so quick overview of 543834, which is the proposal. So on a single page, what the proposal consists of are a couple of suggestions for changes to AU base, starting with terminology. So I guess at a high level, we're adopting the FHIR extension in AU base. And as part of adopting it, we need to profile some of the fields within it to refer to specific terminologies and specific value sets and underpinning code systems. So we've identified 2 code systems to support adoption of RSG, which I'll go through in a couple of slides, and similarly 4 value sets. Secondly, the gender harmony RSG extension will be profiled and introduced in the AU-based patient, related person, and practitioner profiles. We'll, as I said, update the bindings in those profiles to use the new value sets. And we also add profile-specific implementation guidance to the profile pages. As discussed in the last FHIR Work Group meeting on this topic, we discussed and agreed that we will add a table which describes the expected use of RSG, including its sub-elements, for RSG data we know is currently in use. For example, sex and gender values in passports, birth certificates, Medicare, the HI service, and Opera. We'll update the examples for AU-based patient-related person and practitioner. And we actually have some initial adoption of RSG in, I think, an unprofiled state and an associated value set, which was introduced as workarounds in the current or previous versions of AU-based. So we'll remove those as no longer required. Before I get onto the terminology, are there any questions just on the sort of broad approach to how we introduce this? All right, great. So terminology, and yeah, again, I want to start by thanking Keith and others who've commented on the proposal, in particular in relation to terminology. Some of those comments have been taken on board and have informed this updated slide deck. Right, so the first code system being introduced is one to support the RSG type. And this is a revision of the original proposal, which had far more concepts and went down to state and territory specific birth certificates and so forth. So we've simplified all of that down to what you see here at the moment. Now note, this isn't everything that's in the value set. It's just the additional concepts which we need, which aren't anywhere else right now. So we've added types for passports from any jurisdiction, birth certificates, driver's license, citizenship, etc. And I do note that Australian driver's licenses and citizenship certificates do not have sex or gender values on them, but that doesn't mean other countries may not. Birth notification, and then infrastructure services and insurance schemes like Medicare, Opera, Miles Record, PCA, and NHSD. This is the starter set. Part of the reason we're putting this in AU base is so that it can evolve over time, but this we think is a reasonable set of new concepts to be added to support RSG types. Are there any questions on RSG type before I go to the next code system?
If I were to record sex or gender that's in my local system, which is not one of these particular ones, is there a way, have we yet got a preferred way of doing that, or is that something to be worked on later?
Yes, we're kind of going to get onto that, but in short, Richard, these concepts will be part of a value set which will be extensively bound to RSG type. So obviously with that, it means if a type in that value set is not appropriate for your use case, you can absolutely use a different concept. And I think Heath was next.
So this element and associated terminology doesn't seem to align with the intent of the extension. So if I interpret this, my interpretation is that RSG type is to be able to indicate that what kind of recorded sex or gender, such as sex assigned at birth, and which is one of
we're getting to the value set which has that. Yep.
But these look like document types to me, which go into a different element, which is document type.
These are concepts which contextualize the sex or gender it was recorded in. They aren't all document types. The ones at the bottom are infrastructure or insurance schemes. Those organizations which record or issue the places where the RSG values show up have their own semantics related to how they've captured it, what the intent of capturing it was, etc. So I don't know how you'd otherwise convey that.
Yeah, I don't think that the semantics of this field aligns with this value set. Is my comment.
Look, I think that the semantics of the field aren't very well defined in the gender harmony specification, but I'm happy to have that continued discussion with you, Heath.
Which is going to be my comment, and I guess I'm after Heath, is related to this. I feel like what is being proposed in our set, noting, and I agree that these are the additional ones. So what is already proposed is a set that has the value for sex, which has a value for sex assigned at birth, and a value for another kind of sex. And I would view these additions as saying, I can't actually tell you this is the sex assigned at birth. What I can tell you is I've got a value and it's from the birth certificate. So it's a way to say I have a recorded sex or gender, but I can't say it's legal or billing or administrative or something. I can just tell you this information about it. That does suggest to me, though, given we recognize the concepts of not just sex assigned at birth, but also like legal or billing, that we probably need to have those codes if what we're saying is this is the kind of value we have, and that we would only use these where we're unable to clearly, I guess, define the use of the value.
Yep, my understanding is very consistent with yours, Danielle, and I guess to Reed's point is I don't expect too many people to be using these when what they know they have in front of them is the sex assigned at birth. But in the absence of knowing that, you've got to have a type associated with these things, either one that's of your own organizational semantics or whatever the source of the information was.
I'll go a little further because this is probably what's throwing people, just to say that. So if you know, for example, this is sex assigned at birth and in your jurisdiction, you can reliably get that from the birth certificate, or that's where you have, you might have your RSG type, say sex assigned at birth, and the source document might be a birth certificate.
Yep.
But if in your jurisdiction it's not reliable, or you don't know if it's sex assigned at birth, you might end up having type be birth certificate and the source document be birth certificate.
Exactly.
That's what's being proposed.
Yeah, and before I go to Angus, who's next, I just want to say that use case you just noted, Danielle, is absolutely the reality that's coming to Queensland from June of this year, when individuals will be able to change the sex on their birth certificate to whatever they want it to be, including their gender identity. Accordingly, you can no longer rely on a birth certificate to give you the sex assigned at birth, and thus you would then, if you're using RSG here, use this code for birth certificate with the jurisdiction of Queensland. Angus.
Sorry. Yeah, mine a bit simpler. So I just wanted to question why we have my health record and not HI.
Not every miles record. Okay, so we do know that every miles record corresponds to an IHI. What's very unclear is what happens after you've changed your sex in Medicare and accordingly the HI service. And that happened after you have documents in the miles record system. So the other thing is you could receive a CDA document from some other party separate who claims it came from the miles record. And that's what they'd include, or that's what you choose to include. So it is unclear right now, to me at least, what the relationship between sex/gender in the HI service and the miles record is. If someone can accurately tell me or reliably tell me and confirm that they are always consistent with each other, then we can only have one.
Brett is next, I think, and then Liam, and then Daniel.
Cool. Yeah, I want to agree with Heath, really. I think these are really source document codable types.
We've got a different value set for those, Brett, so we're coming to that. I'm not suggesting that these things aren't source document types too.
Yeah.
But the context in which they're being used here is to contextualize the RSG value.
Yeah, but I think, to me, and this is probably the definition of the type element, it to me that is more at a very high level category indication of, you know, if it reads sex on the document, you would record the type as sex, and then you would
So there's a difference there. There's actually a source document field element in which you would describe the name of the field on the document. So that's separate to the RSG type too.
Yeah.
I just wonder whether we can generalize these. Like, maybe there seems to be a grouping here that's coming from like a document, and then the others are coming from a system. So like Medicare is coming from a system, APRA, My Health Record versus like birth certificate. Do we really need to distinguish between a sex on a birth certificate from a sex on a passport when we've got the document type coming later? We could just say, you know, sex on a document and then refer to the document type down further to determine what type of, but otherwise this is just going to get so big. And you start having debates like, you know, My Health Record, HI service, you know, where does it live? But anyway.
Look, if you didn't, as I said, we are providing the options. Not that everyone will necessarily need to use all of them or any of them. I do think that there is a very important reason to differentiate between sex assigned at birth and system, document, or organizational level RSG values. And while the source document type may tell you what it came from, it isn't by itself telling you all the semantics. So, but anyway, we've got some other hands. Liam?
Yeah, sorry, I'm on the same same sort of point. But I was just wondering, like, if you can't tell the difference between whether it's a sex or a sex gender, and then you can't get that information from looking at the source document, what value does putting the type in provide? So, like, could you just have a missing type, like you don't actually know what type of sex or recorded sex or gender it is, but you just know that you've got this value from a source document? What's the requirement to actually have a type of these kind of things?
I think, and Danielle may have this to your hand, I think it's an optional. I think all of these fields are optional.
Yeah. So it just feels like we're
optional.
duplicating.
In that case, I would much prefer it to be the abstract, as in what we've got is some recorded sex or gender field. We can't even say it's recorded sex or recorded gender. That would be much more comfortable for me to include that. But it is optional.
All right. Richard?
Just a little piece perhaps for clarity. The one that refers to Australian Medicare, to the extent that Medicare is the custodian for the for the health identifiers, maybe in that thing, in the definition, put a comment to say this includes health identifiers or Australian health identifiers.
Yeah, so thanks for raising that. This is actually an error on this slide. There's meant to be a concept for HI separate to Medicare. You can't join them, Richard, because there are individuals who have an IHI and don't have Medicare.
Right. Okay. I was surprised at the implication that they were the same. Okay, that's good. Thanks.
Sorry, that was an oversight on my part. Thanks for pointing that out.
All right, Danielle, is that your new hand or old hand?
Yeah, sorry, it was. I was commenting previously on something else. And I think I wanted to bring up here that we might need to, in order to make progress, and I very strongly believe RSG needs to be an AU base, that if this ends up being something where we need to work through, how does it work? We may want to actually say, let's have some use cases and define how they get represented and go through agreement on those, which might lead us, if this continues to be contentious, to how do we use these kinds of concepts.
So I think the proposal is that we would do that anyway, but I do want to offer a compromise here, and that is to say that I do agree that the first 5 document level concepts here can be replaced by a single one, which is sex on a document or just something on a document. But the last 4, I don't really think there are documents for APRA, My Health Record, PCA, NHSD, and so forth. So I would suggest that if everyone's happy with us replacing the first 5 with documented RSA or something like that, and keeping HI, Medicare, APRA, etc., that we could go with that.
If you've got a sex, so Medicare, the Medicare one, you'll get that off a Medicare document or a Medicare screen, which could substitute for a document. The My Health Record one, you'll get it off a My Health Record document, or it'll get it off an interaction. So I think in the case of those lower down ones, you'll actually see them from a document which has been produced by the system.
I don't know if there's a document that has your Medicare, Opera, NHSD, or PCA details on it. Take your point about My Health Record CDA documents.
So I actually disagree with that, because the My Health Record maintains patient profiles separately, and you can edit your address and everything like that, and that's not document, but that is your profile. So I would have suggested that the MHR one is more controversial, and we would need to know, is that from a document, or is that the patient maintained profile?
Yeah, I guess I'm sort of thinking that, when I'm working with a computer screen to get the information out of a system, is that different from getting it from a document in a way that is worth talking about in this data element? Maybe we come back to type.
Yeah, while we are thinking about this, I just want to raise a housekeeping issues. We have another 45 minutes left for this call, and there are 2 other outstanding items that we need to discuss. So, Ruben, can we wrap it up at the top of the hour, or do you need more time?
Sure. I'll try my best to wrap it up.
All right.
I might suggest then.
Do we need to make do we have a motion on this item and vote on that, or do you want to sort of handle everything at the end?
My intention is to raise a motion to accept at the end, and I'm confident I can get through the proposal by the top of the hour. What I'm not sure is just how many more questions there'll be. So I might suggest we do the questions at the end of the slide deck, and we can try and deal with everything then in the allocated time.
Yep, that's fine then. I will let you drive, but be mindful about that. We need to, we do have a stop for this discussion at the top of the hour, and we might sort of give and take sort of a couple more minutes, but probably no more than that.
Yeah.
Heath.
Okay.
Heath?
Can I just suggest that, because given that you want to do a motion at the end, Ruben, this particular value set or code system, cause the rest of the motion to receive negative votes purely on this. What if we were to drop this from the motion, or motion it separately, so that we can move on the rest of it and just leave the existing 3 items, if not 2 items, that are in the underlying code system?
Yeah, like my intent was to make a motion that amended at least this code system slightly, and so if there are any others, we can discuss them along the way.
I guess what I'm thinking is we could always come back. We could always come back to the code system at a later date after it's in AU base. That's my thinking.
We could. Okay. Let me move forward, and we'll come back to this and decide exactly what I want to say.
Contention. Yeah. Okay. Thank you.
Yep. Okay. All right. So the second code system, very briefly, is, as we alluded to in the last discussion, a code system for source document types, and this would be suitable as values for RSG source document codable concept. Don't have to spend too much time here. They're very similar to the last ones, and we'd use them in a very similar way, just for the source document and not the RSG type. All right, moving to the value sets. So we'll be creating a example value set, which very much follows the approach taken with in the Gender Harmony IG, and that is to leverage the values in the existing administrative gender code system, male, female, other unknown. And we will be introducing a value for non-binary. Now, I did have one in the proposal, which he kindly let me know it was a snowman concept, but has been retired. So I haven't had a moment to find one in another code system. I'm pretty sure it exists somewhere. And we'll use that code system. So that's the value set for example, binding to the RSG value. Next, we've got a value set for the RSG type, and these values, I note I've not included the document types. They were included, or maybe this is fortuitous that I didn't. But as Danielle mentioned earlier on, this is what would be bound extensively to RSG type. So there you'll see sex assigned at birth, sex and gender from LOINC, and all of those infrastructure system concepts which we went through before, as well as a value for sex/gender, which we discussed in the last FHIR Work Group meeting. I'm sure there'll be questions on this one. We'll come back to those. I only have 2 more slides. The document type values to be bound in the value set, they pretty much leverage what we spoke about in the code system we've introduced. So passports, birth certificates, driver's license, and citizenship certificates. Note this is the value set this time, not the code system. And lastly, RSG has a jurisdiction which helps contextualize where the RSG value came from, and it would be used in conjunction with the source document. So if you have birth certificate there, rather than coding the birth certificate to be specific to Queensland or whichever state, you put the state into the jurisdiction element. And this value set has all the countries and regions from the extensively bound value set in the international RSG extension, which I note was deprecated in R5 and work's happening to move that to THO. We won't be using that value set, but we'll be using this one, which then also includes all the Australian states and territories from the NCTS code system for those. And that is my proposal. Before I check if there are any other questions, apart from the RSG type code system, are there any other potentially contentious issues anyone would like to raise? Danielle?
To be fair, I at least put this on the Jira before the meeting. So in my view, the RSG is, as we've said, it's where we don't know that it is gender identity or the sex parameter for clinical use. But we might indeed know that is sex assigned at birth. We might indeed know it's some kind of recorded gender. And I think that, as I know we're keeping in this proposal, that the binding to RSG value. So that's what we actually say this is. I know we're keeping it as example, but I don't see the value in putting in an entire value set and overriding that in a U-based patient to add in the value of non-binary, when that only works for certain things. If we know it's sex assigned at birth, we'll want to use the SNOMED for that. And so I don't think it's worth us going this far in like a AU-based patient. I think we absolutely should agree on what the value sets are for the users, including sex assigned at birth, or if we're doing billing or administrative, and having the value sets for that. But I don't think it's worth going to the effort of this level.
Can I
Is that
check,
clear?
Danielle?
Sorry.
Not quite. I've got some clarifying questions.
So let me put it this way.
First,
so in AU core patient, when we put in RSG, in order to say not the RSG example value set, but this other example value set, we will have to go to some effort to do that, noting it's still not the right value set for some of the uses of RSG, and we're still going to need to document in AU base the recommended value set when you use RSG for things like sex assigned at birth. And it won't match what we've just put in the profile. So I don't see the value in going to a lot of effort for an example set.
Okay, so look, I agree with the effort on an example set, but just to clarify, are you then suggesting that we keep that value set as it is in the cross paradigm gender harmony implementation?
Yes, which is only one value different than what you've proposed. So it won't have non-binary.
Yep.
But that in AU base, like patient, we need to have sufficient guidance for the use cases, which I assume is the next step after just putting RSG in. We actually have to agree on how do we do this for sex assigned at birth? How do we do it for other cases?
Yeah. Yep. I'm happy with that. That makes sense.
All right,
And Heath.
I just put it in the chat as well, just for those that haven't had the privilege of reading the draft AUCDR before it gets released. It is suggesting the biological sex value set for sex assigned at birth. So I think I'm aligning with what Danielle was saying, that we may have to be careful about the value sets that we're assigning for this, because we may need to use different value sets for different types of recorded sex at birth.
That's part of the reason that the proposal is going to actually describe which values should be used for the different known RSG types. So look, I guess as a final point there is I'm happy to remove the introduction of this value set from the proposal, and we can go with the one that comes with gender harmony as a default.
And I just also put in the SNOMED code for the term identifies as non-binary gender as the replacement for the non-binary one. But I also have I don't know if that reads quite right in the context of some of these either. So it reads right for gender, but doesn't read right for sex.
Yeah, exactly. And I do note that there's a lot of documents out there have adopted the value of X when it's, I guess, non-binary or something similar. So yeah, I guess I guess we don't need to consider that one for this proposal if we're dropping this value set from the proposal.
It's probably the easiest way to move forward.
Yep. All right. So I'm not seeing any other hands. So it sounds like the only, apart from dropping that value set, it's this code system here, which is problematic. And what I'd like to propose or test with everyone is whether we could replace passport, birth certificate, driver's license, and citizenship and birth notification. So what's that? The first 5 rows here with a single code for document and define it as a sex or gender recorded in a document, and keep everything else. And those first 5 will then be the corresponding concepts for the source document type can be used instead to reflect where it comes from. And for things like Medicare, AHPRA, etc., we use RSG type. So that's my proposal. Richard?
Is it important to distinguish, in a sense, something like government issued document as opposed to just a document? Or
it might be something like a BUPA document. It could be it's not necessarily government, I guess, is the point I'm making.
Right.
I don't think it's worth differentiating.
Yeah, all of those examples are government issued documents, and there's a bunch of areas where people like, say, government issued identity document and so on, but that might not be important in this case.
Yeah, I will flag that birth notifications aren't necessarily government issued. Those birth notifications are what get generated in a maternity ward in a hospital, including private hospitals, and go to births, deaths, and marriages. Danielle?
I do want to raise a amendment to the part on the proposed source document types, which is very specific. I'm happy with the proposed types of source documents.
Yeah.
But in the JIRA, it's a HL7AU document type set, and some of those I think correspond to LOINC, and I think we should use LOINC wherever it's available.
Accepted. Agreed.
Yep.
Heath?
Just going back to your previous amendment, I wonder if we can generalize even more, and I guess in line with the kind of things that they've already got in the HL7 code system. If we just, I know it's repetitive with the concept, but if we just had recorded sex or gender as a type that covers all of these, including the Medicare. Kind of along the lines of where Richard was going with the systems, you could probably find a document that reflects what those systems are as well. But whether that just simple recorded sex or gender is enough.
I am opposed to that because it removes the utility of RSG for use specifically in the context of things like Medicare claiming or lookups in infrastructure solutions.
Okay.
I think now might be a good time to also note that everything we're discussing here still has to go to ballot with the HL7 Australia membership. So it's not set in stone, and there will be more opportunities to comment with issues. And I note we've got 2 minutes, and I'd like 1 for my motion. So Richard?
Look, mine was a quibble on driver's license, given that Queensland issues a drinking license, which is not a driver's license, an adult proof of identity card, proof of age card. That's not relevant in this time frame.
Okay, and I'm not sure it has sex or gender on it. Do you know if it does? Richard?
It's basically a driver's license, which doesn't say permission to drive. It has everything other than permission to drive.
Yeah. Right, so driver's licenses don't have sex or gender values on them, at least in Queensland and all other Australian states and territories. Heath?
Can you just summarize what your proposed new value set is or code system is? Is it any of these?
Yeah, it is. So it's everything from Medicare down plus the HI service and a new concept for document, which is sex or gender recorded in a document.
So something like documented sex or gender or something like that.
Yeah. Yeah.
Is there anyone from PCA on the line? Does PCA hold this information?
I thought I saw someone from PCA.
Can you guys hear me okay?
Yep. Hi.
Yeah, no, at the moment, PCA doesn't store sex or gender for healthcare providers. It's something we may support in the future, but not at the moment.
Great. Thanks for that clarification. We can drop PCA.
Yep.
At this time. All right.
So are we ready? Are we ready for a motion?
Yep. I move we accept the proposal with the amendments stated, which I hope Jessica has dutifully documented, and I will pick up in the proposal.
Can you clearly state the motion so that Dushi can record it?
Do you need me to, Dushi, or can you go to the recording?
Dushi, you're on mute.
You are mute.
You are still on mute.
Oh, it looks like maybe we will just have to for the record, just to make sure.
Yeah.
So Dushi says she's fine. I'm just sitting next to her. So Dushi says she's fine with the proposal.
Okay.
Yeah.
Okay. Thank you. So I move that we accept the proposal with the amendment stated. Stephen?
All right, thank you. And the amendment being that replacing the first 5 with a sex or gender recorded in document. Is that correct?
That's right. And
okay.
The other part of the amendment is we will drop the RSG value, proposed value set, and we will also replace concepts for birth certificate and other things which exist in LOINC with those concepts in LOINC rather than define them in the code system. Is that about it, Danielle?
And
I think
do we should it be 2 motions or do we want to roll them into one?
I will roll it into one because what we're doing is I'm moving that the proposal accepted with stated amendments.
So Ruben, did that include the amendment to remove the PCA item?
And removing PCA.
Yes,
thanks. Rachel, is that why your hand's up?
Yes, thanks.
Thanks, Rachel.
Thanks, Brett. Top.
Stephen?
So are we clear about the motion? anyone has further questions? All right, if not, then anyone has comments about the motion?
I think we need a second before we on to
Oh, yes, that's
discussion.
true. My apology. Yes. Do we have a person who second this motion?
I'll second it, Richard.
Thank you, Richard.
Thank you.
All right. With the motion on the table and being seconded, any further questions or comments on the motion? All right, hearing none, let's call to the questions. We have 19 on the call, and I enter in as a duplicate, so therefore there's 17. Anyone who want to abstain? All right, hearing none. Anyone oppose?
One abstention.
Oh, one abstention. Okay, sorry, I didn't see that. All right, there's one abstention. Anyone who oppose? All right, hearing none. So that means we have 1600. Oh no, 1610. I beg your pardon. All right.
Thank you,
Motion
Stephen.
carried.
And thank you, members, very sincerely. I appreciate it.
Okay, with this wrapped up, thank you, Ruben, for driving the discussion. Very interesting. I will take back the control to share. All right, Ruben, can you stop sharing? I don't seem to be able to take back control. Thank you.
I did.
Yeah, thanks. All right, let's go back to the meeting agenda. The meeting agenda item number 5. We're going to the FHIR Work Group co-chairs have discussed some options that about rearranging the meetings. In the context of there are going to be 3 days of face-to-face meeting in March, which is a few weeks from now. So Danielle, do you want to take us through the options and then we can open up for discussions?
Yeah, I'm happy to do that. So I wanted to bring it to the FHIR Working Group because for this one and some of the others where we've got some like the proposed connectathon dates, and I should stop saying proposed because those dates are locked in. So 20 to 22nd. And the 20th is a joint plenary working group meeting day, which is to say that any HL7 AU working group who wants to hold a face-to-face meeting can do so on the second half of that day. And that for us, as the FHIR working group, is right sandwiched in between our usual conference calls. Do you want to actually click on the image a bit, Stephen, so that gets bigger?
You mean that one? Yep.
Yeah, that one. That should
pop
up a bit easier. Yeah. So this is the March schedule. So our typical fortnightlies would be March 13, March 27. But with that connectathon, that means that we could make use of that for face-to-face, as can the other working groups. AU Core will do that. And I wanted to bring that to the attention of this group to decide what we want to do. So we could, for example, keep all those meetings if we're that keen. We could decide to cancel one of the conference calls and make use of the half day to do some of the AU FHIR business. And we also have the potential suggestion that if we don't want to hold a full half day on the 20th, if people are keen also, there's the next day, which is Connectathon. We could try for an out of hours, 1 hour there. So the Connectathon day goes till 4:30 in the afternoon. So we could kick off at about 4:45 and go through to 5:45, assuming there's enough interest for people to do that rather than going off to drinks. So I wanted to put this to the group to ask, where do we want to land? Can I get comments now from people on on what the preference is. Is there any interest in doing the face-to-face meeting with this opportunity?
There are pros and cons of both options. Daniel, would you want to articulate some of the pros and cons for people to consider?
I think, okay, so our current FHIR Working Group conference calls are, as we're going through these, they're an hour and a half, and we have the opportunity for a session on the face-to-face to do a longer session and get through some items or some backlog of work that could be very useful, and also look to include some items that are more easily tackled in a face-to-face session. But the con of that, of course, is that there may be more than one group holding a meeting at the same time, and thus people will be split between which meeting do they go to. So that's always one of the negatives. I think the negative on the 21st day is simply that it's a bit later in the day, and so where there are advantages in that there's a crowd there on the Connectathon day who can then have the opportunity to visit, I guess, a FHIR working group and be involved that way if they weren't already coming on the 20th for the plenary and otherwise. And I think the negative there is simply that it gets in the way of drinks and dinner.
By the way, you can still go to drinks and dinner after that.
Yes. Any other of the positives or negatives, Stephen, that you think is worth bringing to the group's attention?
No, I think you have articulated very well. So I think there are pros and cons for either way, and it's a matter of people to consider whether or not we want to be competing with other concurrent sessions, or we want to make our day longer on the 21st. So something for people to consider. I personally have my own preference, but as chair of the meeting, I'm not going to impose my preferences on the others. This is an open forum. I want everybody to be comfortable with the group decision.
The other thing I'll note for this is, although it's a face-to-face meeting, I think we've had some thoughts about trying to ensure we've got a polycon. So it could be a mixed hybrid in the afternoon for the FHIR Work Group.
And I do have a portable polycom to bring to the meeting, so that problem wouldn't be an issue.
So I guess I really want to gauge the crowd. Do we want to do the face-to-face, or will we not, and just do the two virtuals?
Danielle, and just to confirm, the AU core group is definitely meeting for half day on the first day, yeah?
Yes, it is.
Yeah. So AU core will definitely be on. Just noting that as well.
So the AU core meeting will be in the afternoon and the plenary will be in the morning, correct?
Yes, that's right. The plenary is the morning until lunch, and then the working group slots are open.
How many of us are part of both core and the working group? Because that would then make having simultaneous meetings problematic.
Assuming you want to go to both at the same time, sure.
I wouldn't want to go to both at the same time, but if they're both scheduled at the same time, I'd have to choose.
Yeah.
I know people have put that to me, but that's what always with a conference with multiple tracks does. Like, you've got to pick the thing you're going to, and you can move between rooms. Yes. There'll be afternoon tea, and there should be agendas so that you'll know whether you're interested in participating in one or the other.
Yeah, I think that would be good if we could make sure we have agendas and potential timings for things, because that would be helpful, I think, if we are going to run concurrent. Yep.
So I'll sprue what I would like us to do in the FHIR working group, which, no one's agreed to it all yet. I'm just going to throw that out there. We've got a huge backlog that has been there for like 5 years around AU base. And I really want us to get through, revisit and disposition that. And I think that could be an opportunity to have a longer afternoon session, is to just bring that up and go through every one of them and say where our position is. Are we still working on it? Do we transfer it across to JIRA? Is there anyone in the room who originally raised that? And can we get a much better picture of the work around that? That's one of the things I'd like to do on that day.
So the first option is to have a concurrent session day 1, which is the 20th of March, and run it in concurrently with the AU core meeting in the afternoon. So that's the first option, correct?
Yes, I think so. Yes.
All right. Anyone opposing to that option?
No,
I'm happiest with that if we've actually got agendas for both of them to help us work it out. Because at the moment, if they're both just 1 o'clock to 4:30, then there's sort of you sort of show up and sit there and then go with the flow and see what happens. If there's more of an agenda, I think it's easier to decide that having 2 simultaneous is a good idea.
Yeah, I think with that review of items, I think we'll have to pre-triage, and I think we'd like to group them by topic or theme, right? And have some session, like if you're interested in medications or whatever, we've got different areas. That would be helpful, I think, because they're different people. Probably.
Well, I have been thinking about that, Brett and Daniel, sort of, and in particularly in response to what Richard and the other have said, that the decision will be a lot easier when we have an agenda item for people to consider. So a fallback situation is to do an online poll. We have we have the agenda all fresh out, and then put out a doodle poll or survey monkey type of thing, and get people to vote as to what their preferences are. So that's one way of moving forward on that.
For that to be useful, we'd need to convince the core people to also have an agenda.
Yeah,
we will have an agenda.
Yeah,
AU Core has an agenda 6 weeks out all the time, and that gets maintained.
I think that's good, because then we can kind of, if there are like-minded topics in each group, we can avoid each other in terms of the timing. So that way, people can, if they're interested in that subject, they can get to both parts. But we just need to coordinate a bit and get and time box some stuff probably.
So how about we consider this sort of like suggestion from me that we set up the agenda and then put out an online doodle poll or survey monkey to gauge the response, and then the work group meeting co-chairs can convene at the next meeting and then decide.
So now I'm going to ask Brett and Ruben to put your HL7AU hats on, because you have to book a venue with rooms, and that costs money.
Yeah.
And that has to happen soon. So, and if there's not interest, and that's okay. Like, what even if there's 2 juicy topics on at both times, which hopefully there are. We should be doing working group business. Everyone should be excited about both of them. Then does that mean we don't have the AU FHIR working group one? Heath?
I just can't see how we can run them side by side. Given the people that are on this call, I would also expect to be in the AU core group.
That was my initial sort of thinking as well. But I think in the light of people suggesting that we get the agenda fresh out before we make that decision, that can be a way forward.
The way these meetings seem to go, I don't think that we will be able to say I'm here for this agenda item and then I'm going to go next door. I don't think that's going to happen. But that's maybe I'm just pessimist. Can we break these into, say, 2-hour blocks or something like that? So at least both groups gets a good chunk of time to make some progress. And I realize AU Core might have a lot more work to do or something or other. I don't know. But whether it's 3
So
hours, 1 hour, maybe we can do another breakout session on the next day as well. So even if we had 1 hour on that evening, plus a breakout in the afternoon, maybe starting at 4 o'clock or something like that.
Hey, I will say there are breakouts. So this is work group meeting, not the break. So there are breakouts across both the Connectathon days on various topics that will need to be scheduled and worked through. So that's going to happen.
Yeah. And hence we've already got rooms, and I'm just suggesting that maybe this can be yet another breakout at the end of the day when perhaps hopefully we've got vendors off doing work and
which is the option for the 21st, that we can do a FHIR working group there. But that being said, if I know I'm clearly mad keen, but I will cope if nobody else is and we don't do it. That's okay. We don't even have to have a FHIR working group meeting during this time. We've got the 2 conference calls. That can be the decision we make.
Yeah, I would kind of I think it would be good to it's good to do that stuff face to face because you can get through stuff pretty quickly. Also, controversially, is there any potential, would anyone be willing to give up their plenary session or part of? Because there's a half a day of presentations in the morning.
Well, that's one option because the plenary session.
For that. Yeah.
I assume that the plenary sessions will be recorded, so therefore people can always go back to that. What you miss is the interaction.
Yeah.
So there's one option of holding a concurrent session with plenary, and then the other option is still to, if we want to avoid clashes, is to run the late afternoon session 4:45 for both days. That way, then we avoid the clashes.
See, Ruben.
Thanks, Brett. I'm with Danielle here. I think given so many of us are going to be at this event in person, it would be a shame for an official in-person meeting of the FHIR Work Group to not occur. And I appreciate that there are challenges here. But I feel like if those responsible for the agendas for both afternoon sessions can get together and arrange their agendas so that I guess best efforts to ensure that things that some parties would go to AU core sessions for wouldn't conflict with things they'd want to go to the FHIR Work Group for. And if necessary, we can do stuff in the early evening or late afternoon. But I'm pretty sure there's enough to be discussed. And even if it's not IG specific stuff like AU based, strategic stuff, I would think this would be a great opportunity to discuss, like discussions like what are we going to do about R5 or R6? How do we work better with HL7 International? Potentially members of the AFCC could address the FHIR Work Group and you can ask questions of them. I think this is a unique and not frequent opportunity, which we should embrace. Thank you.
Danielle?
Yeah, I was going to totally echo what Ruben was saying there about, we've been doing a lot of content around AU base, which is great. And obviously that's what we've scheduled. But the FHIR Working Group has that governance and strategic remit. And it is a good opportunity to do that. Yeah.
All right, so what's our decision? Work out the agenda, put on a doodle poll, or just work out the agenda and go with it?
I wonder if we should send out an electronic vote to the folks. People aren't necessarily speaking up, but we could decide on that because.
Yeah, in the interest of sort of democratic decision-making process, my initial suggestion is sort of to flesh out the agenda and put out an electronic vote to get people's feedback, and then we can decide on the majority decision. And that's probably a good way moving forward. Whether or not that will be too much administrative work or not is for the group to decide.
Go, Richard.
An idea in the chat is we grab the start of the plenaries and we go from 9 to 11 with our one on the basis that the initial opening hour is sort of formal but not informative.
So we can put those options on the Doodle poll or online poll, and then we can sort of get responses. But I think those options.
Like, I'm not HL7OU, but I'm really concerned about that because that'll be rooms that they haven't factored in. So it's not part of the venue costing and booking. So I don't know if that's even feasible.
Good point.
Yeah.
Good point. Yep.
Yeah, I'm not sure what the plan is even for the venue now. So yeah.
Yeah.
So I love the spirit, but yeah.
Look, I think in the interest of time, my suggestion is to work out the agenda and put the agenda onto the with a link sort of to the online polling, and sort of ask for options, voting for the options with with the proposition that there will be face-to-face meeting. So we have an option of either running concurrently with the work group meeting, with the AU core meeting, or running sort of in the late afternoon for both days, starting 4:45. So I think those are the two options, and that we can do online polling on. Are we in agreement for that?
Yeah, I think that's what we've come to.
Okay, awesome. So I think that's settled. Let's sort of run with that, and the co-chairs will work through the logistics. All right, now with only less than 6 minutes left, we have one final item before the next meeting. So the final item is looking at reviewing the AU Core Inferno testing framework project. So here is the link to that. And there is a PDF document and a few questions asked, and you can put in the commentary in there. Do we have a closing date as to when we need that by, other fellow co-chairs?
Sorry, I didn't put that in. But I expect we would want to discuss this at the next meeting, which is
the 28th.
Yeah, 28th. Yeah, 28th. Yep. So
can you put a date on there
to
get people at least sort of
target
sort
that?
of 3 days before the next work group meeting, so therefore people can have time to peruse and put their comments in there.
Yeah, terrific. So so that one's about some more testing facilities and things. So this is things that will get hosted by HL7 Australia. So it needs an approval to essentially use the resources. That's it.
Yep, all good. All right. Then next meeting will be on the 28th of February. So I will see you all here again on the 28th. All right. And once I do see completed the meeting minutes, I will put a link to all the 3 meetings links to this next meeting. So therefore we can review and approve that. All right. With that all done, I think we are ready to wrap up this meeting unless there are other questions. Any further questions before we close the meeting? All right. Without any other questions, motion to adjourn the meeting.
Second.
Okay. All right. So the meeting adjourned at 1:27 p.m. Sydney time and 12:27 Brisbane time. Thank you everyone for the very energetic contributions and discussions. We're looking forward to see you at the next meeting, which is in a fortnight.
Thank you, Stephen.
Thank you.
Thank you
Thanks,
all.
everyone.
Thank you.
Bye.
Thanks. Bye.
Bye.